ADHD and ADD by Danielle Millett. In this presentation, we'll be discussing the two disorders and how are they interwoven into each other. Definitions. Attention deficit hyperactivity disorder, ADHD, is a brain disorder marked by an ongoing pattern of inattention and/or hyperactivity impulsivity that interferes with the functioning or development. The condition known as attention deficit disorder, ADD, although it is considered an outdated term, the American Psychiatrists Association released a Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, in May 2013. The DSM-5 changed the criteria necessary to diagnose somebody with ADD. Here are two of the different pictures of ADHD and ADD, and you can see in it how they're closely interwoven. Inattention. Overlooking or dismissing details, having problems sustaining attention in task or play, not seeming to listen when spoken to directly, not following through on instructions or fail to finish homework, coursework, chores, duties in the workplace or task, easily sidetracked, having problems organizing tasks and activities such as waiting to do in sequence, keeping materials and belongings in order, having messy work or poor time management skills, and failing to meet deadlines, avoiding or dislike tasks that require substantial mental effort, losing things necessary for tasks or activities, being easily distracted by unrelated thoughts or stimuli, being forgetful in daily activities such as chores, errands, learning to call. Sorry, my dog's having fun. Hyperactivity and impulsivity, fidgeting and squirming in their seats, leaving their seats in situations when staying in your seat is expected, running or dashing around or climbing into situations where it's inappropriate. Teens and adults often feel restless, unable to play or engage in hobbies quietly, being constantly in motion or on the go, or in fact as if driven by a motor, nonstop talking, blurting out answers before the question has even been completed, finishing other people's sentences, or speaking without waiting for your turn in conversations, having trouble waiting his or her turn, interrupting or intruding on others, for example, conversations, games, or activities. The risk factors. Scientists are not sure what causes ADHD, but like many other illnesses, the number of factors can be contributed to ADHD, such as genes, cigarette smoking, alcohol use, drug use during pregnancy, exposure to environmental toxins during pregnancy, exposure to environmental toxins such as high levels of lead at a young age, a low birth weight, or brain injuries. ADHD is more common in males than females, and females with ADHD are more likely to have problems primarily in inattention. Other conditions such as learning disabilities, anxiety disorders, and conduct disorders, depression, substance abuse are common with people with ADHD. Treatment. There are many types of treatment for ADHD, but most of the common is medications. But there is also some natural remedies that are told to parents, like foregoing food colorings and preservatives, avoiding potential allergens, try EEG biofeedback, consider yoga or Tai Chi classes, spending time outside, behavioral or parent therapy, and then what about the supplements? Zinc, L something, B6, and magnesium. Medications. There are two types of medications that are given to children with ADHD. Short-acting stimulants, which are listed below. Some of these side effects included loss of appetite, weight loss, sleep problems, irritabilities, and tics. They require frequent dosing, so the FDA has issued warnings about drug abuse that could potentially happen with taking these problems, and it also may increase heart and psychiatric problems. Intermediate and long-acting stimulants. A lot of these side effects are, again, including loss of appetite, weight loss, sleep problems, irritability, and tics. They have a greater effects on appetite and sleep. FDA has issued a warning with drug abuse with amphetamine stimulants. Here are some of the list: is Adderall XR, Concerta, and Ritalin LA. Non-stimulants tend to have more side effects than the other medications. Tips to help people with this disorder. For kids, keeping routine, organizing them, using homework and notebook organizers, being clear and consistent, giving praise or rewards when rules are followed. For adults, keeping with routines, making lists and different tasks and activities, using a calendar for scheduling events, using reminder notes, assigning special places for keys, bills, and paperwork, and breaking down large tasks into more manageable, smaller steps, then completing each part of the task for a sense of accomplishment. References. Discovering the different references in the book and also different other things. Thank you for watching and have a good weekend.